Good afternoon, everyone. My name is Will Marie Newton, and I'd like to thank you for joining us today. Today's presenters are Robert Rader, Executive Director, Patrice McCarthy, Deputy Director and General Counsel, Sheila McKay, Senior Staff Associate for Government Relations, along with other members of the CABE staff. Should you have any questions, please type them into the chat box and we will answer your questions after the presenters have concluded their discussion. We will try to get through as many questions as time allows, but if you have further questions after the webinar has ended, please feel free to email our presenters and they will answer them at their earliest convenience. Please note that this webinar will be archived on CABE's website under Professional Development. And now I'd like to turn it over to CABE's President, Donald Harris.
Good afternoon. Thank you, Will Marie. Just to begin, to put everything in the proper place, everybody should know that I speak to you today, not only as the president of CABE, but also as a former teacher, high school principal for 39 years, and a board member in Bloomfield for the last 10 years. I have lived through this pandemic with grandchildren in all levels of schooling in the state. There has been a lot of work and planning that has gone into this reopening plan. We are in a place now where none of us have ever been before. And I'm imploring everyone to exercise flexibility, which will be a key word as we ready our school systems to open in September. It's going to be vitally important that we, as board members, work with each other to support our superintendents, staff, for the ultimate achieved success of all of our children. I thank you for this time, and please stay tuned for Patrice and Bob's message, and Sheila. Thank you.
Well, we have a number of things to talk about this morning, obviously. And if you hear my doorbell ringing, I don't know why it's ringing, but I'm going to stick with you because I think this is one of the most important webinars we've given. The attendance shows that, and my reading last night and this morning of the new plan, which you all should have, also indicates that there is much for school boards to do. There is also much for staff to do, and I want to start out by talking about this as being an opportunity for school districts. You know, over the years, everybody talks about we don't want more mandates, we need more local control. Well, this is, believe it or not, one of the biggest opportunities school districts have ever had to show flexibility, to show how one size doesn't fit all, to show how they can continue education even at a time that we know that the COVID disease is still out there. I know that the governor added to the number of states which have to quarantine. People have to quarantine from them if they come to Connecticut. So this is very much a live issue. But I will also tell you, having worked on this for the last few months and having served on the Education Reopening Subcommittee, that we are in a much different place than we were even 4 or 5 weeks ago. So I think what you'll see as we go further and we read all of the different parts of this is that, and we're not going to read it to you, obviously, but as we go through it, you should know that you have flexibility and you still have responsibilities. Even in the face of this problem, even though we hope that in most cases you will work very closely and communicate well with your superintendent, you do have the roles and responsibilities as in the governing statement. Hopefully you know that's on CABE website. you have a job to communicate, especially with the community. And that is one of the biggest things that is called for in the plan. You have the responsibility of being the eyes and ears and to pass on to the superintendent or the board as appropriate what is going on outside. Your role remains the same, and that is connecting the will of the community to the education of its children. And again, as I just said, while nobody expects you to be an expert on COVID-19 or exactly what kind of disinfectant to use, you should know enough so that you can answer questions and reassure the members of your community. So, as I said, we are going to go through this fairly quickly, adapt, advance, and achieve. And again, there is a lot of flexibility here that you will have to work out at your local district. So let me jump right in. I actually went through the forward very carefully for you. And I think the most important thing you need to know is that beginning June 30th, SDE will launch the Connecticut Learning Hub, which will provide universal access to high quality, high impact online learning content. What you will hear from us again and again is that while the idea is for all students to go back to all schools in the fall, certainly there has to be left open an opportunity to do distance learning as appropriate. And the state is providing this educational learning hub in order to make sure that districts have what they need as far as content. So there will be content in English language arts and science and social studies, the arts, and PE. Again, as we go through this, and as is discussed in the foreword, safety and health of our students is the most important part of this whole plan. In the introduction and guiding principles, they talk about six different things that are the guiding principles. And I'm not going to get into them in detail, but you should know that, once again, safety and health of our students and staff has been the key consideration, allowing all students the opportunity to return full-time in the fall. Equity issue, but it's also something that is good for our students and is good for our staff. Monitoring the school, the students, the staff is also very important, because you have to be ready to either isolate people, and we'll talk about that, who have COVID or are thought to have COVID, and you have to make sure there's a plan, as I said, for students who may voluntarily decide, or their parents may decide, not to send them to school. We have to emphasize equity, access, and support to students and communities as they are coming back. And there's a whole part in this report about social and emotional learning, and it's not only for students, it's for staff as well. Fostering two-way communication with partners such as families, educators, and staff is also part of what this calls for. So what you're going to have by July 14th, when you have to send in your plan for each individual district, is a number of plans actually contained within the broader plan. And we'll talk about that. And you have to make decisions about reopening because there are challenges to physical safety, social, emotional well-being, and mental health needs of students and staff. So there is a lot that school boards, working with their superintendents and, as recommended, working with committees, will do. The State Department of Education has said in the report that they will help the local teams that will work on this. I know that we had discussions in our subcommittee and elsewhere with the commissioner and his team. They made it very clear that priority districts will get quite a bit of help as they need it. The report also talks about how we had worked with SDE, CAPS, and CAS on equity issues. That is one of the first things that is mentioned in the report, and it's just a reminder that we have to help all of our students, and we have to make sure that acts of racism and anti-Semitism do not belong. I would also tell you, at a time when I've heard from those of Asian descent that because the COVID-19 started in China, they have gotten a lot of negative things, racist things said, even if they were not of Chinese origin. We have to be on the lookout for that type of thing. The fall reopening model is, as I'm sure you will read, again, calls for us to go back to school in the fall. Our education will be primarily in person, but districts will have to have a continuum of strategies for that in person. And for, as I said before, those who were decided not to come forward and go to schools, or if there are class cancellations. Equity, again, an important part. Cohorting, a word I hadn't heard till last week, which means keeping some students together. Much easier, as the report says, in grades kindergarten through 6th or 7th, also 8th. That is just a common sense way of having as few people exposed as possible. They understand in this report that high school students don't really work in cohorts as do the lower primary grades and middle school, but it is encouraged that students do that. You're going to be doing surveys of your community, find out who's coming back and who's not. You have to look for room, or at least I am saying you, but it's certainly a team effort. As we have said, looking for room if you can't do social distancing to the proper extent. Look at rooms in other municipal areas. The plan for buses, somebody will talk about that. And certainly special ed and EL students are those who have the priority. But at any time, you have to be ready to modify your plans as is necessary. I already talked about temporarily choosing not to participate. Those who have decided not to participate, there are suggestions in here finding teachers who can help students as they do not participate and do distance learning. You'll have to have a school liaison person assigned. There have to be communications plans and data collection. And with that, I'm going to turn it over to Patrice, who will talk about the operations plan in more detail.
Thanks so much, Bob, and good afternoon, everyone. I want to begin this section actually by quoting from the Massachusetts reopen plan for schools, because I think it reinforces the context that President Don Harris set for us. And the Massachusetts plan says, to have a successful school year, we will all have to be problem solvers, flexible, and responsive to data, and willing to course correct as necessary. And I really believe that that's an important message for all of the work that we're going to be doing in the coming months, and certainly in the first half of the next school year. So the document requires, in terms of your operations plan, that by July 24th, every school district, as well as the charter schools and the incorporated and endowed academies, submit their plan to the State Department of Education. The plan must be submitted. It does not require a process for the department to approve or modify that plan, but they want to have it on file. They're going to identify best practices, and they'll be using that as they consult and support school districts during your reopening process. Now, it's important to remember that many aspects of this plan will be very much operational, and this is point where we talk about the role of the board and the role of the superintendent. It's the responsibility of the superintendent to develop the operational plans and procedures and protocols. It will be the responsibility of the Board of Education to work with the superintendent to communicate those plans and to identify the resource needs, because part of the July 24th submission is to inform the state of resources that your district is going to need. We don't have commitments yet from the governor or the legislature as to how they will help you provide those resources, but this will give us the data we need to make that case. Questions have already arisen. Is it a requirement that a Board of Education actually adopt the plan? It does not specify that in this document. A board could delegate that responsibility to the superintendent, just as you do for many other actions. But I certainly think it's important that a Board of Education understand what the plan is, because you are going to be a key component of conveying to your community confidence in this reopening plan. One of the requirements, and for those of you that have looked at this document, it's laid out in terms of things that are absolutely required and things that are guidance. For the classroom layout, a absolute requirement is that you maximize social distancing between student workstations. It does not require a 6-foot physical distancing between each student. It requires that you do look at other opportunities in the community and whether you could repurpose other space in your building. It also identifies the possibility of using module classrooms. The school construction unit in the Office of Policy and Management has committed to working with our larger districts to identify their space needs and presumably to look at mechanisms for state support to make the facilities modifications that some districts will have to make. Another one of the suggestions in this document is that you think about having small cohorts of students come back to school before you have a full reopening, to help them become familiar with the policies and procedures and the new protocols. And again, that's going to be very much a local decision, whether that's feasible in your district and whether it would be useful. It is a requirement that there be training for staff before classes actually resume in terms of the health and safety protocols. And that's really the same thing that's being required of businesses as they reopen. That can be done online, and that can also be needs to be made available to students as well as staff, and families should certainly be encouraged to participate so that they have an understanding of the protocols. The whole communication piece to your community, your staff community and your parent community is going to be critical to developing that confidence that they will need in order to send their children back to the classroom. There is a lot of specific guidance about playgrounds and hallways. And again, for me, that really falls into the area of those are administrative procedures that your staff is already working on and will need to continue to work on. With that, I'm going to turn it over to Sheila to talk about nutrition.
Good afternoon, folks. Just to be brief, because we do want to eventually get to your questions, and we're on page 13. So you must still comply with national school lunch programs and breakfast and after school and milk programs. And you also must still comply or monitor and comply with USDA regulations. And then you must have sufficient documentation to back up those students that have qualified for meals and so forth. That's not changed. What you will see changed in terms of what you now need to think about is the distribution methods for students that are in school. You need to think about the fact that you may very well be providing meals to students in school and students that aren't in school. So those unanticipated school closures as well. You also need to think about, and well, you are thinking about a decrease in revenue because you won't have necessarily a la carte items being purchased at a great level. And then you need to think about always working with your local health districts in terms of any protocols or anything new that might be coming down the road. And then notifying parents as to the changes in the scenarios that are working for lunches and breakfasts. And then also be cognizant of what needs there are to deliver these lunches, what PPE might be involved. And I will end there and turn it over to Rebecca. Rebecca, we can't hear you.
Sorry about that. There is so much to cover, but certainly you should know that we've talked about this, and our board chair check-in on Thursday will be mostly discussions, questions and answers from board members. And we assume it will focus on the same document.
Everything they need to know about transportation they can read. There's absolutely nothing.
Okay, you're on. I can hear you. Do you wanna? No. I mean, you're. No. Okay. So we're experiencing difficulties, as you can imagine. So basically, what Rebecca is trying to get you in touch with is the fact that there are protocols with masks on buses. You need to think about pickup and drop off, and then you need to be aware that there could be greater parents transportation events coming through the school systems as well. Did you want to add anything in particular?
The only requirements listed are very much the same as for other things, that masks have to be worn at all times by the bus driver, and the students need to be on before they get on the bus and off as they're leaving the bus. Again, in the logistics department, we'll be looking at having some masks on buses, just like you will be having some masks in schools. Right now, looking at what they're calling sort of the low status, which is a lower threat, so you can have as many as you would normally up to capacity. You're looking at changing possibly in the future if that data changes. But those, and you will see a difference in loading buses all the way to the back and loading all the way, and then unloading from the front, and no changing seats in that area that Patrice was referencing about resources. Your superintendent and administrators will be looking at whether to use monitors and how else to do those things, and they'll be coming to you for support for those resources.
Okay. The next section does deal with fiscal and budgetary considerations. You ought to well be considering from the department asking guidance on planning, and this document that you're sending in, your planning document, will really help the state understand the local needs. So that's why pay particular consideration to these fiscal concerns for protective materials, for cleaning supplies, for increased staffing, any type of equipment. And then also know that there are opportunities for to maximize the resources that you may have coming into you through the CARES Fund and the Governor's Fund as well. There are the opportunity for you all to do surveys about devices and connectivity, and update policies for what might be school-owned devices, and then just realize that you need to think about as well a robust, as that word uses here, blended learning. So you know, different opportunities you have for having learning in the fall semester. And then recovery as well. There is consideration around the fact that there has been some learning lost, and there will be needed resources into helping students to move along. And with that, I will turn it over to our health practices and protocols. Okay.
But what's happened is that we're having trouble unmuting people who have to speak. So I think we should go on. That's what I just heard from Will Marie. But we will go on, and certainly
Sheila, we'll go to Sheila and we can go back to Vin when we can unmute him.
great.
Okay. 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 So there are extreme sensing the needs of health practices and protocols. You will be required to engage in new expectations, social distancing, more hygiene, more emphasis on hygiene, mandating the use of face coverings, and then the etiquette on how to cough and so forth. And then again, more cleaning and enhanced cleaning. And then going back to the financial end of this, do you have supplies for cleaning? Do you have masks available for those that don't have them at the moment or lost them on the playground, whatever it might be? And then training staff as well. Training staff on proper hygiene so that they can then help reinforce that with the students, and then providing reminders and looking at how students are, educators and students are just reminded to keep washing hands and so forth. There is guidance here on immunizations and health assessments that the department has already issued. And then requirements and necessary around stay at home and returning to school. There are ways in which the school as a whole can help educate parents and educate students on the reasons to stay at home, should anything suffice that they need to be home. And then all of a sudden looking at the opportunity to return to school and what that criteria would be. If you've been sick or if you have recently been had COVID as well. Social distancing, as Patrice mentioned earlier, there are no particular 6 feet rules, but in consideration outlined, they are looking at just opportunities to spread out more in using different rooms within the schools, and potentially looking at your hallway structure in terms of the ways in which students are moving throughout the building. And looking at adjusting the guidance from CDC might be coming down the road, and just be aware of how those rules are following. Material sharing, they're talking about students touching doorknobs and desks and just high trafficked areas, and how that would be fit into your plan, and we need to be cognizant of that. There is talk here on the use of face coverings and face shields, and again, reiterating the fact that they will be required. And then just more on hygiene in terms of touching of the face, and setting clear guidelines regarding the coverings when other mitigating practices are in place, such as eating and drinking and during gym, and then teachers and staff, so long as they are properly social distance, remaining behind a physical barrier if they need to, and developing a consistent policy to address masks breaks throughout the day. So do you have additional masks on hand nearby? More emphasis on where medically appropriate, nurses should substitute use of metered doses of inhalers. Aerosol generating procedures cannot be avoided. Different face shields with face mask more may be used by staff who support students with special healthcare needs. And staff working with students who are not wearing face coverings due to one of the expectations cannot maintain social distancing should be provided increased protective equipment, and whether it be gowns, masks, shields. Then we get into the next section, which is health monitoring on page 22. The planning and distribution of information. There are requirements included in your reopening plan for protocols for monitoring the symptoms and while complying with relevant policy and health laws. So you need to be ever vigilant as to what the latest practices are. You must review, in terms of now guidance, review the most updated guidance, as I mentioned. And then expect there could be a reason to daily screen. At the moment, they're saying you do not need to daily screen, but guidance could change. So have a plan for if that comes into play. Attendance. Expect that to explore the ability to code students and staff with specific symptoms. But you need to be ever vigilant of guidance in doing that in terms of privacy concerns as well. Create a communication system for staff and families for self-reporting, and for families to notify the school for known or presumed cases. There will be, as the document does state in the beginning, this is an ongoing document. There will be future guidance on related to parents and students who choose not to participate at the moment and how that attendance would be monitored. So look for that coming out. In terms of containment, included in the LEA, your plan will be written protocols for containment and immediate response. In terms of immediate response, they want you to make sure you've talked with the health department. They want to make sure that you've notified SDE. They want to make sure that you got a response team. What considerations of what signs and symptoms have been exhibited would require the immediate dismissal. Have that in your plan. There are reasons for an isolation room. The isolation room, besides the health office, to accommodate students who exhibit symptoms consistent with COVID until a parent or guardian arrives. There are reasons to create a consistent policy for dismissal of students or staff who exhibit symptoms. And initiate recommended CDC cleaning protocols following a case that may have been discovered, or that is discovered. Moving on to cancellation of classes, remote learning, and reopening plans. This specifically gets into what will be assumed now for the fall will be a low risk, so 100% capacity, going back, 100% on buses with face coverings, identification or isolation of students who are sick, cohorting, as Bob mentioned, maximize spacing, as we've all mentioned, and increase cleaning. And then it gets into different protocols in terms of, if it's a high risk, schools will be closed. So the document is there. So your plan will look at cancellation and reopening. We'll strongly have procedures in place for that, and notify and consult SDE, as I did mention. And then if it's a specific geographic, looking at geographic scope in terms of if it's a single school, if it's a multiple schools, if it's the whole district, what those considerations are, and when how that plan works if it's greater than one school. Include a communication piece of your plan in terms of talking with faculty and staff, talking with parents, whether it's individual roles and responsibilities in the event of a shutdown occurring during the school year. In terms of future planning for remote blended learning, because we know that remote learning has greatly been necessary in terms of continuing our school year this year, and we know that parts of this will continue to go on, be prepared to provide remote learning and maybe immediately upon a cancellation of class. So that's, we can't say enough about the great efforts that have been made across the state of Connecticut by school districts all the way down, everybody that's been involved. We want to make sure that you have the opportunity to communicate with parents or guardians regarding those plans, and also consider what the distribution of food and devices and learning materials would be. So there's many considerations there. The document also says to define what remote learning looks like to the community. So, you know, we definitely heard that synchronous or asynchronous plans were being developed, and we just want to make sure that the document asks you to make sure that what plans and what the community and the parents and teachers and students can expect from those plans. There is a document that is called the school decision tree, and it asks some important questions that that help guide your conversations around what your plan will look like. And I would urge you to look at that on page 27.
Sheila?
And with that, I turn it over to Nick, I believe.
No, we're having some technical difficulties.
Bob?
Will Marie
Excuse me,
cannot unmute people. So those of us who are unmuted or unmutable will finish this off and leave time for questions. The organizers, were Don, Sheila, Patrice, and myself, cannot see the questions. So what Will Marie has been nice enough to do is text them to me, so I will be able to read them. But let's get through the document first. On academics, you already heard about the Learning Hub. One of the most important things said in this is that because we are concerned about kids' social emotional situation when they come back, it's very clear that the State Department of Education wants us to make sure that kids feel comfortable coming back to school. There'll be a lot of anxiety, not only with the students, but also with the parents. We will not test when we start school. The department made that clear. They think the department thought that we already have had enough tests and that issue will not arise for a while, that teachers can talk to teachers from the year before, and they also have the information and data from the year before. So no single test will be necessary. So moving on, there are parts in here, and I don't want to get into the details, on handling kids who have special needs, as well as English language learners. Excuse me. They also talk about physical education and what has to happen there, and arts and music education, which you know, has the questions of how many kids can we have in our choir and so on. Just so you know, the report says maintain proper spacing of at least 12 feet when students are singing or performing wind instruments by scheduling large assemblies in auditoriums, outdoors, cafeterias, gyms, or other large spaces. Focus on maximizing distancing for instruments that require blowing or for singing compared with string and percussion instruments.
Bob,
Yes.
I just wanted to let you know that I was able to get everyone unmute that needs to be speaking unmuted.
Terrific. Terrific. So we're now more or less on 11. Patrice, that's yours. I didn't mean to cut you out. I see that Rebecca thinks she's Sheila now, but that's a different story.
Before I go, since Vin is unmuted, I know that we've had questions on last week's webinar about CABE's policy support. So Vin, if you could speak to that, please.
Speaking to the issue, most of what you find in the document really has to do with operational issues. If anything, I found that there's an overuse of the word policy, because policy is basically what you want to see happen, and then all of the detail is in the operation. The only place I saw in the document itself where it talks to the need for a new policy is the one pertaining to facial masks, and we'll be in the process of getting something out to you very soon on that. But for the most part, your existing policies are fine. In some cases, you've had to suspend them rather than need to change them, because again, the situation is very fluid.
Thanks so much, Vin. And thank you for all your good work in all of the policy areas. I'll
I
talk a
want
little.
to take a quick minute to thank
Go ahead.
Sheila, because she covered my area beautifully under health practices and protocols.
Great. It's quite the team. Briefly, the family support and communication provisions. This is clearly a key component. We know that as schools reopened in other countries, some families were unwilling to send their students back initially, but as they became more comfortable with the protocols that were in place, they then decided that they would be sending their students to school. So two messages from that experience. One is that even if you do a parent survey now and a certain percentage of your parents say, no, they won't be sending their students back to the classroom, that may well change by September 1st or a week or two into the school year. And secondly, that the communication piece is so important so that people are aware and comfortable with the procedures that you're putting in place. Another key component that has been touched upon by a couple of the members of the staff is the social emotional piece. And there is a requirement that your plan focus on re-engaging all students, staff, and families, especially those that have been disengaged during the distance learning months, and that you pay attention not just to the needs of the students, the social emotional needs of the students, but of the staff as well. And that classes, teachers look at those first few days or weeks of school as reestablishing your routines and your relationships. And again, that goes back to the guidance that we are not going to be doing standardized testing the first week back in the classroom, that there's going to be a much more personal focus on the needs of individuals in addition to their academic needs. With that, I'll turn it over to Sheila to wrap up the last section.
You're muted, Sheila.
Okay. The next section is staffing and personnel. We briefly, the plan that you'll submit needs to be looking at a substitute plan. In terms of guidance, they're looking at measures of surveying the experience from the spring in terms of how did that work. Assessing if schools will require increased staff. And then they do mention a opportunity on the state's website for EdSite active endorsement search tool for looking for additional staffing. And then specifically plans to support staff health, implement flexible sick leave policies and practices that enable staff to stay home when sick, who have been exposed or caring for the sick. And they also say engage with staff labor representatives and consider whether an MOU, a memorandum of understanding, are appropriate or necessary to define the roles of different staff under the context of COVID. And in terms of professional development, they want staff to be able to have training in some of the things we've already mentioned: health protocols, hygiene practices, PPE, reporting illnesses, supporting SEL, social emotional learning. How's that first day going to go? Patrice was talking about that. How are you going to embrace, not embrace, how are you going to approach students where they are, which is another term we've also heard. And then professional development, those committees that are established within the school districts need to continue to meet to talk about the supports needed for staff, and then talk about the professional development around technology, training in effective student engagement, again, how to meet students where they are, and provide professional learning to build educator capacity for SEL services as well. And that wraps that up.
Okay, what I'm going to try to do is read the questions as we go. I've got 4 or 5 different pages of questions from Marie, which I appreciate, but my eyes are not as good as they used to be. So the first one: have you received any clarification as to what the state feels the maximum class size or cohort group numbers may be? Well, we didn't get really a specific number. Certainly the report talks about cohorting, keeping kids, and this is one of the other questions, keeping kids who are in the same grades together to the extent possible. I don't think the state went further than that, Patrice.
No, they did not.
And guidance on how to handle cohorting for transportation to and from school. I know that they said members of the same family should be together, but I think that's a real logistical nightmare, and schools will have to figure that out as they can. Okay, I think we've discussed cohorts. Will the state be sharing guidelines on closing classrooms or schools based on a student or staff member contracting COVID versus being exposed to someone who has a positive test? I didn't see that specifically. Certainly the boards or the district's plan will probably want to address that. Patrice?
I think there was indication that there would be further guidance coming on that as we get closer to the reopening, again, as the health metrics continue to evolve.
And SDA made it clear that this is what they called a fluid document and that things are going to change as we move forward. Report said 724 for the plan. I misspoke. I said the wrong one. Patrice corrected me. Thank you, and I apologize for that. Questions about masks, especially for younger children. Do you think that the state will issue guidance on how to handle compliance with this requirement? I sort of doubt it. They have discussed it no end. I know that from the subcommittee I was on, but I think each district is going to have to make its own decisions there how to handle it. Would you elaborate on the temporarily choosing not to participate? Can any family choose to opt out of going to school this fall for any reason? That's what it looks like for me. If a parent feels that their students are should not be in the regular classes, that parent will have the right to do distance learning for the student. That's why the surveys are so important that are discussed. Each district has to finish surveys or send out surveys to parents and, if appropriate, members of the community. So when we get to September, we'll have a better feeling for how many students are actually going to come to school. We know from other countries, and Patrice has talked about it a few times, that once most kids in the neighborhood start going to school, others will join as soon as they can. But there was total ability of any parent not to send their student back. Staff training for safety and protocols. Is there some standard training being developed that districts can take and then modify for any special protocols that are local? Good question. I didn't see anything particularly for staff, though I believe that the RISCs are actually working on this very issue. I have gotten some information from, I think it was sent out by the RISC directors talking about such things. Teresa, you have any information, or Sheila?
No.
Okay. On page 21, it notes the use of a face covering for all students and staff when they are inside the school building, with certain exceptions. The exceptions do not include when the teacher is providing instructions at 6 foot social distance. There is also no exception for when students are seated 6 feet apart. Can we push for the face mask requirement to only apply when we have buy-in from the community? And what I'd say on this is that I think the State Department, because it's changed somewhat on distance and how far, the social distance, how far apart students have to be and teachers, since they've changed that, the mask is really the strongest tool that we have to keep COVID from spreading. And my own belief is that, and knowledge is that, the State Department of Health approved what is in this plan. So even though it may not say 6 feet anymore, certainly the requirements of wearing a mask do remain in effect, except in those exceptions which are actually in the plan. Patrice or Sheila, you want to add anything to that?
No, I would just say that in any classroom configuration, even if the desks are 6 feet apart, we know that as soon as one student gets up from their desk, you're likely to lose that 6 feet. So that's why the masks are particularly important.
Oh, Sheila, anything you want to add?
I would just also mention hand washing, making sure they provide the opportunity for students to be able to wash their hands as often as they think they need to.
And certainly there are things in the plan talking about disinfecting, and there are things, when you read the plan, you might want to read it online, since there are links to the CDC and other groups with more detailed information on some of the areas. That's all I have right now from Marie. You have more? Oh, you want to read them? That's great.
Well, we've gotten some more since the last one that I sent you.
That's great. Go ahead.
Okay, so next question is, what is the teacher union's role in setting workplace operations, like potentially having classroom instruction live streamed from the classroom for students who are home to view in real time?
Patrice, you want to take that one?
I think those are issues that are going to be worked out in local communities. Some communities work that out during the spring distance learning. It may require entering into a memorandum of understanding or a memorandum of agreement, which is essentially an amendment to your existing bargaining agreement.
Okay. The next question reads, will there be flexibility in Alliance District plans to adapt to new needs regarding compliance with the reopening protocols?
Well, SDE made it clear that it was going to work with the priority districts in particular, providing technical assistance and so on. So I would think that if that is part of the plan and it's been discussed with SDE, that there will be not specific waivers, but there will be ways to work within this plan that make the most sense. Again, the Alliance districts will get will learn about the help they can get from SDE. And certainly if there are best practices, we'll try to send them on as soon as we can.
Okay. Next question, is the state going to put resources for staff training to all of the protocols for health and safety of staff and teachers?
We don't know the answer to this. One of the things that the commissioner made clear is that districts should be adopting or looking at budgets specifically on what they have to do in their adapted, advance, and achieve plans. Then I believe the governor said that they would look at the plans and see what they can do. There have been no promises of any funding beyond what districts are already entitled to.
Okay. Next question, with so many required changes to policy items, I know that CABE said they would create some recommended COVID type policies for topics like attendance, illness, mandating mask usage, etc. When might we see these policies, or at least the list of what policies might need to be suspended or revised to support the new state guidance?
Vin, if you're still on, I'm glad for you to take that question.
Am I on?
Yes,
You're
you are,
on.
Ben.
I'm on. Okay. I started working actually today on the one pertaining to face masks. Some of the others, again, let's say, for example, attendance is one. Really, the policy itself doesn't need to be changed because clearly we recognize in policies that attendance is crucial to student achievement. It's in terms of how we deal with the issue, the operational aspects. And those are going to have to be pretty much dealt with locally because that comes under the heading of administrative regulations, the detail, who's going to do what, when, where, and how. So it's very difficult to come up with a total list. We've, in two policy highlights, one in April and one in May, we identified some 50 or 60 policies that we recommended you look at as a checklist for issues that you need to consider as at that time as you were dealing with the remote learning, but those are also issues that you need to consider as you put your plan together for the reopening.
Thank you, Vin.
Okay. Next question. How do we explain to parents and students the logic of no social distancing on a bus with a directive to social distance as much as possible in school?
Well, I think they're trying to make I think SDE, working with the Department of Health, is making the best they can of a bad situation. We know that if you had to really socially distance in buses, you'd have 6 kids or 10 kids at the most on a bus, and you'd never be able to start school because all the kids wouldn't get there at the same time. Plus, there would be huge costs. But we do know that the masks are really the key, at least as far as I can see, for what the Department of Health thinks is necessary at this point.
Okay.
Next question, or Patrice or Sheila?
Nope, that's good.
Oh, folks, we said we'd go over a little. It's 1:02 already, but we want to try to get to as many of these questions as possible. And I remind board chairs that on Thursday, we will be talking in our regular board check-in and update. We will certainly pass on any news of changes in this plan. And certainly we would like to hear the board chairs talk about what they're doing in their own communities and school districts. Next question.
Next question. If we're not testing at the start of the year, how will teachers know what areas of weaknesses students have with last year's curriculum in order to build support prior to teaching new material that might need to scaffold or build on from prior lessons?
Another great question. I think it says in the plan that there's a belief from SDE that There is already enough information, and that teachers should talk to the prior year's teachers of the students to help out with this. I think the idea was we don't want everybody back at school immediately being tested, considering the trauma that many of our students have undergone since we closed down school in the middle of March. But there are suggestions in the plan if you have a chance to look at them.
Okay. We are getting a lot of pushback on mask wearing, especially for students. Are breaks from wearing masks going to be allowed? Parents asking if kids can sit at their desks without a mask if desks are 6 feet apart.
I think there is provision in the document that talks about the plan, including opportunities for mask breaks. I'm not sure that that's going to apply the entire time that students are supposedly seated, because as we said, particularly with our younger students, they may be seated 1 minute and up and about the next minute. But I think there is, and one of the things that I've heard in some of the posts that parents have put online is that it's often our younger people who are much more adaptable to things like wearing the masks than the older members of the community.
Okay. Next question. Is there a suggested number for cohorts of students?
No.
Okay. What can we expect regarding requirements to pay bus companies next year if we go to distance again? Will the 180/900 requirement be enforced again next year? Are we to read this guidance as requiring that we reopen and a full distance semester is prohibited?
I think the document and the governor's message clearly envisions at this point, based on the current health data and assuming it does not regress from where we are, that schools would fully reopen with the opportunity for families to continue distance learning if they chose to do so.
Okay. If a parent homeschools, will they have to repeat that grade when or if they should decide to return to the school next year?
I guess I would make a distinction between homeschooling as we know it now and participation in a district distance learning program. Clearly, if you participate in district distance learning, you would progress as you would in the classroom. If you are homeschooling either before the pandemic or during the pandemic, then I think the district's procedures for a re-entry to school from homeschooling would apply.
If I may interject for a moment, this is one of those areas where there is policy language in place that determines that very issue of a homeschooler coming into the situation and how the staff would determine where to place that youngster.
Next question. Can staff opt out of going to school and ask to distance learn instead?
That's going to depend upon whether or not, it's going to depend on many things. The first would be whether there is a medical reason that makes it impossible for them to be in the classroom if they have a medical excuse. There are some new federal requirements in terms of leave provisions, and there are also local collective bargaining agreements, all of which apply.
Okay. The next question reads, will staff development be done virtually due to social distancing? I am concerned that schools were not designed for social distancing in any manner.
Certainly it's a choice even before the pandemic in terms of how professional development is delivered to staff. So delivering it virtually is certainly an option.
Next question reads, do you have any insight into why masks are required in Connecticut for K through 2, but they aren't for the same grade range in Massachusetts?
I would think maybe the departments of health might disagree on what's required. Don't forget, we have seen over the last few months, medical experts in these areas disagree. This has been a very tough, time to try to make the kinds of pronouncements we'd like to hear. You know, black and white, things like, if you just wear a mask, you'll be fine. There are all kinds of different degradations of how this, we can eliminate COVID. And I would think in various states, as we're seeing now across the country, the timing of reopening and other things are just different.
The next question reads, our budget for 2021 has been approved. Has there been any consideration for what happens if a district just cannot afford to institute some of the requirements?
We are not muted. This is a very tough question. I haven't heard of anything. Please.
No, certainly we're going to be raising this issue with the legislature. Actually, President Harris, Sheila, and I have a conversation with the Senate Chair of the Education Committee this afternoon, and this is one of our topics.
Can kids bring in their own lunches?
I certainly expect that they could, just as they could pre-pandemic.
Okay.
But they'll be eating them at their seats or outdoors, not in the cafeteria.
Good to know. Next question reads, I have kids too, so. How will the state testing in the spring align to the loss of covering all the standards required for grades 3 to 8? Will students be expected to achieve the same benchmark standards as they have in the past?
I'm not sure that the State Department of Education has gotten to that issue yet. So I think that would be on the list of, that remains to be seen. I think somewhat it will depend upon what we learn about the learning gaps and learning loss that our students experience when they do get back into the classroom setting.
Okay. Next question. Is there any guidance on recess and playground use for our elementary age students? Is outdoor time exempted from mask use?
There is, I believe, in that document, some guidance about recess. I'm not sure it addresses the issue of mask wearing. Would have to take a closer look at that.
Okay. If schools need to purchase additional classroom supplies, such as desks, is there a way to purchase those through a state system at a reduced rate?
I would think that they could go generally through the RESCs. I know they run purchasing pools for various things. I don't know of a state-provided pool, except you can buy off the state contract. But that's something your school business official or school superintendent should know or will know and be able to provide information about.
Okay. And Meg's she made a comment stating that regarding resources, CDC does have resources if you search for videos on their website.
Great, thanks, Meg.
As you go through the report, there are lots of links, and there's a whole resource page at the end.
Okay, and Karen asked if there's no time to get to all of the questions, which we've pretty much covered most of them, can CABE create a question and answer document and a mechanism for boards to ask those questions either of CABE or via the listserv to learn what other boards are doing or ways we can support one another?
Absolutely. Send your questions to us. We will try to answer them. We understand that we won't have all the answers. We can always get in touch with SDE to try to help you out.
Okay. Okay, we just received a couple more.
That's good.
Do you feel schools are in a position to reopen 100% safely if you had school-age children?
I think there's no 100% with this disease. Obviously, some areas of the state were hit harder, and there might be lingering after effects, et cetera. And we don't know if there's going to be a second wave. But I would say that most of our schools following these guidelines, doing what's right in the community, sticking with the statewide Department of Health or the local Department of Health can make it as safe as possible under the circumstances.
Okay.
I would also say that a report from the American Academy of Pediatrics last week reinforced a message that we've been hearing, which is that school is actually the safest place for most of our young people. And we have to remember that every time we encourage students to go outside and play on the playground and use the jungle gym, there is some risk that they might be injured, but weighing the risk of the benefits of physical activity versus the risk, and in this case, weighing the benefits of being in a safe, supported, structured setting outweighs the fact that there are risks which will be mitigated to the greatest extent possible.
And I read, I don't know if it was the same report, but pediatricians said that because of the social emotional aspects of being in school, not being just home, it's better for kids to be in school. I don't know how you quantify the risk versus the benefit, but certainly the pediatricians were saying they're better off in school.
Okay. I have a comment from Francine. I have already asked the Connecticut State Department of Education about eating in the cafeteria, and the answer was yes. With maximized social distancing, students do not have to eat in the classroom or outside. Next
Good,
question.
thank you, Francine.
Next question reads, what are the infection rates at daycare centers for children and staff? Some have been open throughout the crisis, and to my knowledge, children are not wearing masks at those facilities.
I don't know whether they're wearing masks or not. I do know, I just read an article this morning that indicated that those daycare centers that had stayed open primarily to care for the children of first responders and healthcare workers had virtually no COVID incidents. And that's particularly interesting given that those young people are going home to homes where there are people that have had some exposure to COVID patients.
Okay. Next question, do you anticipate the ability of families to choose between in-person and distance learning will remain throughout the year provided we are open?
It's impossible to say, and I'm sure we'll get more guidance from the State Department at some point on that.
I think it's very much going to depend upon the health metrics. If we get to the point where there is great confidence in the preventive measures that are being taken, it may be that the distance learning option is phased out.
Okay. Will parents have the option to sign a waiver to send their children in without a mask?
No. Masks under this, as the guidance exists now, children must wear masks in order to go to school, just like our policies require that they wear shoes to go to school. That it is not just for their own safety, it is for the safety of their peers and their teachers. So parents can't waive that right for everyone else in the building.
We have one more question. What kinds of assurances and guarantees does the State Department of Education provide to give confidence that equity is a top priority, and what steps is CABE prepared to take to be strong allies to those most in need of support?
Well, certainly we've been working on equity. A couple of weeks ago, we had Dr. Martha Brackeen Harris talk to us about equity. We have seen and read what is in the State Department report. we will certainly use our voice to encourage equity for all students. We will continue to work with the State Department, CAS, and CAPS on these issues.
And Bob, I would mention, drive people to the website to look at the equity toolkit, which we hope at some point to make more, it's certainly available, but maybe we'll make it a living document in terms of maybe we'll have a webinar.
Sure, and there will be more webinars by Dr. Harris talking about some of the issues we really couldn't get into the last time we did a webinar. Things like explicit and implicit bias and white privilege and some of the other issues that are really bubbling up more than we've seen in our society, in which we want to take a fervent and strong position on.
We just received another question. What is the position schools take for students who have a medical reason for not being able to wear a mask? Are we required to admit those students to school without one?
I believe that you are, because I believe the mask requirement has the exception for a medical reason.
Okay. And Meg Scotta just shared that CASEL is running a 5-part series about equity and SEL. The next one will be on July 10th.
Who is that? What group?
CASEL, it's called CASEL.
Castle. Okay, and I just finished a very good one that was done by CERC. So there are things out there to learn about these issues.
Megan asked, will they require a note from a doctor for the mass medical exemption?
I would, yes.
Okay. So the questions seem to have slowed down.
Okay. Well, thank you so much, Will Marie. We know it was a little hairy there, and I apologize to any of our staff who were supposed to do certain sections. This was really a team effort, but when the technology doesn't work right, we have to make do. Again, on Thursday, we'll talk to board chairs, and we will certainly be working on these questions and providing, to the extent we have over the next few weeks, answers to them. Anything to add, Patrice? Sheila?
No, we wish everyone a good 4th of July holiday.
Be safe and be well.